Thank you, Premier. This is certainly awful advice to have to give to any government, but it is absolutely necessary. It's painful to have to say it, it's painful to have to go through it and to flag that we've got 6 very difficult weeks ahead of us. But we have been through this before and we did it successfully. We turned the tide with our first wave of infections in Victoria and we drove infections right down again. We're facing as significant a situation this time around, but if the advice of my public health colleagues, infectious disease colleagues, is anything to go by, there is a unanimous view that this is required to avoid absolutely catastrophic outcomes. Indeed, thousands of cases per day, and I know that we will already see deaths from the cases that we have occurring every day. What I do not want to see is any more deaths than are already predicted. We have to drive our daily numbers down. What's happened has been a very significant upturn in the last few days. We did have 2 or 3 days where numbers were 60 or 70 a day. We knew that we had made new restrictions on gathering sizes. We knew that we had gone through a really significant period of engagement with the communities most at risk and where transmission was greatest, and that we really stepped up our efforts in testing. That was with the hope that we didn't need to have to go to another level of public health directions that would be imposed. The last 2 days have shown that that is not going to be adequate. It's been very useful. It needs to be part of our continued efforts, but it is insufficient to drive cases down. And it is only through the imposition of these measures, these really, really difficult measures, that we really have any chance of turning this peak around and saving lives into the future.
Happy to take any questions.
Premier, what will happen?
Many of the recent outbreaks have been into schools communities, several private schools at Altagua College. Is that a big concern, surprise for you?
I was certainly a bit surprised at how much we saw in schools in terms of cases. I think it was a measure of how much transmission was going on around those schools. It was certainly the case that the great majority of cases that turned up in those schools were from kids who'd acquired it at home or acquired it outside of school and then be subsequently identified and the schools closed as a result. Altagua College is probably a different example. There seems to have been transmission in the school that was quite substantial. They are older kids. They tend to have more transmission that's akin to adults if they're not doing the physical distancing appropriately. And so that's been a big cluster in terms of schools.
So given that older kids, are you comfortable with year 11 as well going back to the classroom?
If schools implement and if those kids do the right thing in terms of the physical distancing and a genuine understanding of their individual responsibility to keep a space and to exclude themselves from school when unwell, I think it's absolutely manageable.
Is that asking a lot, though?
We're asking everyone a lot, and it is asking a lot for year 11 and 12s. I think they will reflect on the importance of their education in a face-to-face setting as well as they go into really important years of schooling.
Brent, can you just explain the difference in the public health team having to deal with these type of cases which are coming up in a community more so than the first wave of cases? How much more onerous is that on contact tracing and so on, and how is it holding up?
Look, it's not dissimilar in many ways to what we went through in the first wave. We still have to respond to those positive tests that we get back, get the details from every individual about when they first became symptomatic, take that period of 48 hours beforehand, find all of the close contacts from that 48 hours before right through their infectious period when they weren't isolated. It's been very challenging in terms of the rapid increase in numbers. That's been faster than in wave 1, and in many respects it's faster than in some other waves across the world. I think that's that's a measure of some of the social disadvantage that's been intersecting with the transmission in this wave.
Is there a reluctance for people to provide all the information they need?
No, I think we're getting the close contact details pretty well. it does become more and more challenging the greater number of cases that you have to get all of those close contacts. We do have automated systems to let close contacts know that they need to remain in quarantine, but we do want to go through a day-by-day check-in for all of those close contacts in quarantine to make sure they're doing the right thing, to make sure they've got a symptom check and to make sure they're getting tested if they develop symptoms. And so as the numbers increase, that becomes more and more of a pressure point.
Have you done any more genomic testing, and have you established how this is into the high-rise towers?
I don't think the genomics will tell us how it got into the high-rise towers. We will obviously ask all of those individuals in the high-rise towers who their close contacts are, where they've been in the previous days. But the reality is there's a significant network that all of us have with our friends and extended families, and if we haven't stayed at home by and large, there are lots of opportunities for entry into new settings, and I think the community cases that were out in those postcodes have been connected to some of the residents in those high-rise settings.
Going back to Al Tupper College, it's gone from the first case being notified 8 days ago to 90 cases today. Do you suspect that there'd been a fair bit of transmission going on there before you learned about the first case?
Yeah, I think it's entirely possible that, especially with kids, again, they can get very mild illness. We know that they don't test as frequently with mild illness. The general population doesn't test as frequently with mild illness as with more severe illness. It's another reminder that just that runny nose, that sore throat, or shortness of breath, not just cough or fever, should prompt anyone to isolate, to get tested, so that we can follow up all those close contacts. Because if you're moving around in a setting where you're in close contact with lots of other people, they will become infected, and you can get that explosive increase.
And how many close contacts are you dealing with in that cluster?
Well, we're essentially treating all of the teachers and all of the students as close contacts, and so we've asked them all to quarantine for that reason.
So that's 2,300 people.
That's right.
Can you
Just in
clarify
terms
whether,
of-
sorry, just a quick question. Can you clarify whether elective surgeries will go ahead as one of the 4 reasons to leave home?
I'm not sure. The Minister might have something to say.
Sorry, the Health Minister can do that.
Close contacts being looked at elsewhere, but generally, how many are you looking at?
It's over 5,000 close contacts. So, you can generally take the number of active cases, multiply it by 7, 8, 9, and you'll get a figure for the close contacts that we're looking at.
And just with
So that I think just before we get off that, Rich, that just gives you a sense that
Certainly we're ramping up the review and the support for infection prevention and control in all of those settings that are akin to high-rise towers, even medium density settings where we know that awareness about testing, awareness about hand hygiene and cough etiquette and physical distancing needs to be absolutely maximised. So that's being ramped up. We have had the odd case in other settings, not similar to the towers of Flemington and North Melbourne, but some lower rise towers. And sometimes we've had an individual case, but there's no evidence that there's transmission within the towers. I think it was the evidence that there was transmission within the towers that really sets the alarm bells for us, because it means that all of those residents are at risk.
And Brett, should people be wearing masks now that we're in this climate, I guess? I know the Royal Children's Hospital that staff to wear masks at all times.
Yeah, certainly in health settings, it's a reasonable measure. AHPPC has made statements on masks. I think they're statements that I support, which is really that where community transmission isn't negligible, that masks are a reasonable thing to wear where you can't physically distance. But we're working up some communication materials, and I'll have more to say on that in coming days.
Brett, I just want to ask you as well, are you aware of any close contacts identified through the COVID Safe app?
I'm not. As I've said before, the COVID Safe app is of greatest utility if you're amongst strangers who you wouldn't normally identify as household members, as friends, as family members who you visited, because most people are still only visiting those closer contacts that they're familiar with and have the details of them. The COVID Safe app isn't providing that additional information. I'm sure if there were a case to pop up in other parts of Australia where there's much more mingling with strangers, where pubs and clubs are open, the COVID Safe app would ping some strangers who are not known to a positive case. So it's got it's definitely got utility, and I think it's something that everyone should download. But we're in a situation where the close contacts that we're identifying are those that are already known to the individual.
Any other issues? If not, yes, yeah, Kira, yeah.
Who is thinking that?
You want.